friends. I am myself Dr. Satish Shahane. I am a secretary, Navi Mumbai, Indian Academy of Pediatrics. Today we will be discussing about one important issue that we are facing in the recent time, that is gas geyser poisoning in children. Friends, as a parents, we know each and every society now is having gas supply, Mahanagar gas supply, and we are tempted to put the gas geyser in our bathroom to save money. Some people will say over a long run it will save a significant cost, and many contractors they encourage us to put when we are putting the gas lines. But if you know about gas Mahanagar gas guidelines, it clearly mentioned the Mahanagar gas should be used for the domestic purposes, mainly for cooking. But this illegal use of gas here is really dangerous for us, and that we are facing in day-to-day life. But many of us are not aware about that. This is parents. Many of the parents still think the gas geyser लगा दिया अपना काम हो गया, but it doesn't solve the purpose because it creates one more disease that is called gas geyser poisoning. This happens due to partial combustion of liquid petroleum gas, that is LPG, and the carbon monoxide which releases in a closed room in over time will cause carbon monoxide poisoning in children, in your parents, and as well as in yourself it can happen. So dear friends, it is a sincere request to listen to this 5 minutes what happens with that. So friends, we are getting many children now, especially adolescent females and sometimes male, with sudden acute onset of unconsciousness, with some children present with fits, that is called conversion. Third category presents with delirium, and fourth category that present with severe headache post-ictal. So this kind of illnesses, when we are trying to make out some diagnosis, there is always a history of exposure to the gas geyser. Especially they are found unconscious in the bathroom, or there is some exposure to the gases. So when you are looking at this gas geyser poisoning, when you find out the medical details, it is clearly mentioned that when you are exposed to long time with the gas geyser combustion, that is a partial combustion of liquid petroleum gases, which releases the carbon monoxide in our atmosphere in a closed bathroom, ill ventilated. When the ventilation is not good in the bathroom, definitely unknowingly we inhale that carbon monoxide gas, and that leads to delirium, unconsciousness. We are not sure what is happening with us. That time, if you really see the scenario, the child is not able to understand what is happening with him. He either becomes slowly unconscious, or the child fell down, he get hurts on the head with some bang on because of the wall or something like that, and he fell unconscious. He not able to open the door, and sometimes the child is found unconscious. Many children, those are lucky, they at least some call to the parents, or they at least knock the door, something they call, and then parents they open the door and they found the child is totally unconscious, or he is in total delirium. So this kind of scenario, when you are seeing in day-to-day practice now, it is our responsibility. That means the pediatrician responsibility to make you aware about this entity which is called gas geyser poisoning. So friends, really, can we prevent it? The simple solution for that is to avoid totally gas geyser in our houses. But sometimes it is not possible because you already been installed that, or the expenditure has been already been done. So the solution for that is to either you put the gas geyser out of the bathroom, so that the combustion when happens, the partial combustion, the carbon monoxide which releases in this atmosphere doesn't enter your bathroom. One solution. Second, when you are using, you have to be very responsible about that. You have to tell each and every person in the family about his side effects, which can really hurt you or your dear ones. So the simple solution is to avoid it, or second solution is either to put out of the bathroom, or when you are using it with the child, there is no option. You have to first boil the water, let it get warm, then you stop the geyser, and then you enter the bathroom. But that is very difficult to make in our day-to-day I would say kind of a daily routine, but this has to be followed, especially when the child is coming from the school or from the play, or from the child is totally into hurry, wants to go. So it's really difficult to convince, but the simple solution again is to make the bathroom very well ventilated, or some kind of exhaust we have to put in the bathroom so that it doesn't happen. So it's my sincere request as a responsible pediatrician of IAP, that is Indian Academy of Pediatrics, to tell about the side effects of gas geyser, so that each and every person life, which is very important, every children's life, which is very important for us, we can save. So important thing, again follow the rule. Either you avoid it, or when you are using it, use it responsibly. There are many incidences of gas geyser poisoning, many deaths reported, especially in Bombay side when it started in each and every society as a installation of gas geyser. And there are many instances in the north where it is used for the heating purposes. Because of the cold weather, it is on for a long time in closed room, and this phenomena occurs, and there is a unknowingly the children or the people get intoxicated with the carbon monoxide, leading to many variety of presentation of this gas geyser poisoning, or I would say kind of a carbon monoxide poisoning. So it is our sincere request as a responsible pediatrician to make you aware about this condition. Either you have to stop it or use it rationally. So thank you very much, parents, for listening us. But definitely you follow in your practice, so that any incidences in this, at least in our area like Navi Mumbai, where the parents are very much responsible and aware about the condition, they will definitely. And I request each and every parent who is seeing, whether it is in Navi Mumbai or Maharashtra, abroad, anywhere in the India, they should aware about the side effects of gas geyser poisoning. Thank you, and thank you very much.